Hi everyone, welcome back to iMumz Ask Me Anything session. So, pregnancy is such a beautiful time for all of us. And when I was discussing the topics with Dr. Mitra, I think what she wanted to speak to you all about is okay, yeah. So, what she wanted to speak to you all about is just about how to be happy in pregnancy. Like, how do you have a very happy and healthy journey in the 9 months? So, quickly, I'll just introduce her and she will take you through her whole knowledge that she is. Been gathering over the years, attending to so many pregnant ladies, making their lives such a happy and healthy version of what it could be. So, ma'am, we are very excited to have you here. Dr. Mitra Saxena, she is currently the director and HOD of Ashwini Saxena Hospital. She deals with high risk obstetrics, infertility, endoscopy, preventive oncology, like a lot of things going on parallelly. She's been practicing for so many years right now. She has been the past president of Rewari Obstetrics Society. She's currently the chairperson of Practical Obstetrics Committee FOXY, that is the Indian Gynecologist Association that we have.
What do you
So
reckon? What do you reckon?
I think no matter like how much I introduce you, ma'am, I think it is not going to be enough. A very, very senior consultant. So hope you all get to learn so much today in this session. And please do ask her all your questions that you have that is stopping you from being happy in pregnancy. Over to you,
Uh,
ma'am.
okay, so very heartfelt thanks to iMum's application, all the creators of this wonderful app, and my host Ansuya, and all those wonderful mothers to be who are sparing their time listening to what I have to say. Well, I'll begin my talk with just sharing with you how happy I am as an obstetrician. I haven't been able to change into my clothes and dress up a little bit so that I can impress you. But yes, I want to share that I've come right away from my OT after making a couple happy and myself very happy. This is a primey who I have done section for her, and she has a baby boy and a girl. And what I can tell you from a doctor's point of view is that when a patient trusts you and respects your judgment and unflinchingly just puts their faith in you, that's the time a doctor can do their best role. So, friends, today, my patient was a little bit afraid because she's only in the 34th week of pregnancy. And suddenly, I dropped a bombshell that one of your babies is not doing well and we must get out the baby right now. And she is my patient. She knew that one of the babies is falling a little low on the growth. But what I must say is that it is very much a two-way interaction to be happy, to be satisfied, to be successful. Both the parties have to be equally on the same page. So, because my patient listened to me, so I was able to get out the baby. The first one was her son is 1.6 kg and the daughter is 2.0. And it is that growth difference that the first baby was at a big danger. So, what I want to say is that for us all, the mothers to be and the doctors who are taking care of them, to be happy, the first and foremost formula is that let us just trust and respect each other always. So, now coming to my what I want to share with you people is that in this journey of pregnancy, as everybody knows, this is a very, very great God's gift to the womenhood to become a mother, to nurture life in their body. And so, being happy starts from the day you want to plan a pregnancy. You get pregnant, and if you are fortunate, you'll get pregnant by the natural means. If there is a little bit of delay, all I can say is if you are patient, if you trust God, you're going to be happy sooner or later. And one sentence for all those who are trying and who get desperate, please remember that the medical science has made progress by leaps and bounds. So where there, we couldn't even imagine when we were students that the women without uterus could ever produce a child. But yes, these miracles have taken place in our arena. So every woman must have this confidence that unless there's something really really wrong, motherhood will not, they will not be deprived of motherhood. So this feeling should really make you happy and empowered. Second thing, my message to all the mothers and the fathers and the family is that this is a combined commitment. When a couple is going to have a pregnancy or plan, or the patient is pregnant, it's not just the responsibility or sole thing of the woman or the husband, but it is a combined, it's a it's like a perfect movie where you have to have the best director, producer, script writer, dialogues, actors, actresses, everybody has a very important role to play. So I would say that the woman, the person who is the protagonist, जिसके की पेट में बच्चा पलेगा, वो सबसे important किरदार है, परंतु आसपास के सभी लोग, they are also equally important, the husband, the mother-in-law, the mother of the lady, and the doctor. So make the right choices. This is my first message, that for a pregnant lady, if you are in a good city, before you try and know a little bit of about pregnancy, what are important signs and symptoms, try to get information from the right source. Many times, instead of being happy, a woman becomes scared, they become apprehensive. मतलब कि मुसीबत आने से पहले अगर कोई जना मुसीबत से डरने लग जाएगा, तो शायद मुसीबत आए भी ना, पर उसका वो समय कितना बुरा कटेगा. तो इसलिए एक बहुत इंपॉर्टेंट मैसेज है कि आप इंटेलिजेंट बने, इग्नोरेंट नहीं. बट इंटेलिजेंट बनने का ये मतलब नहीं है कि ज़्यादा जान करके डरने लगो. तो प्रेग्नेंट होने के बाद आपका पहला ड्यूटी है कि आप लोग अपने नेबरहुड के, मतलब जो नज़दीक के कोई क्वालिफाइड, इंटेलिजेंट, रिलायबल, ट्रस्टवर्दी डॉक्टर को चुनिए और टेक टाइम, डोंट हरी. किसी ने कह दिया, आप चले गए और आपको बाद में लगा कि अरे हम तो डॉक्टर से बात भी नहीं कर पाते, तो आप, you are in your right to choose the right person whom you can trust, who is knowledgeable. And of course, we always like references. If somebody can say a good word for a doctor, then that is a added feather in a doctor's cap ki somebody is saying good about that person. So my first thing is that choose the right caretaker, the person who's going to take care of you in 9 months. But once you make a choice, please have one thing in your mind, that you have to trust the doctor. Almost all the doctors who are qualified, who have gone through 10, 15 years of rigorous, hardship in terms of housemanship, senior residency, working 48 hours at a stretch, they are all committed. And every person who is dealing with pregnant ladies, and they are always having a very soft corner for the pregnant woman. So please, my first message is that be happy when you have conceived, be happy when you are choosing a doctor, be happy whenever you are supposed to go for your checkup, and be prepared. When I say be prepared, it means if you've been having any problem, please note it down, jot it down. Don't try to gather information from the wrong sources. And wrong sources में सबसे बड़ा wrong source वो होता है ऐसा रिश्तेदार या ऐसा वेल विशर जो खुद भी डरा हुआ है, जिसका कि एक्सपीरियंस पास्ट वाला बड़ा नेगेटिव है. उस व्यक्ति से, उस लेडी से अगर आप कुछ भी शेयर करोगे तो वो डर वो आपको ट्रांसमिट हो जाएगा. और सबसे पहले जो फर्स्ट टाइम और प्रेग्नेंट लेडीज होती हैं, वो बेचारे सबकी बातें सुनते हैं. तो आपको समझना है कि सब अपने जो भी आपके साथ एक पॉजिटिव और अच्छा एक्सपीरियंस शेयर करे, आप उनसे इंस्पायर हो जाइए. उसके बाद डिपेंडिंग अपॉन योर लेवल ऑफ नॉलेज, हाउ मच यू वांट टू नो, डेफिनेटली आई ऑलवेज एनकरेज माय पेशेंट्स कि आप लोग जितना जानना चाहते हो ज़रूर जानो, पर खाली जानने के बाद अपने तक मत रहो, मुझसे ज़रूर डिस्कस करो, सो दैट आप, मुझे पता रहे कि आपकी इंफॉर्मेशन ठीक है, गलत है, इनअप्रोप्रिएट है, क्या है. क्योंकि देखिए, जो पहली बार प्रेग्नेंट होता है उसको बड़ी सारी चीज़ें नई होती हैं और वो घबरा जाता है. सबसे पहली चीज़ ये है कि आपको एक बात याद रखनी है कि जो हम कर रहे हैं, यानी कि प्रेग्नेंट होकर के बच्चा पैदा करें, ये कोई रॉकेट साइंस नहीं है, ये कोई पहली बार हम नहीं कर रहे. हमसे पहले हजारों लाखों सालों से होमोसेपियंस ने, ह्यूमन बीइंग्स ने बच्चे पैदा किए हैं, और अभी तक अगर सिजेरियन ना हो तो नेचुरल रास्ते से ही प्रेगनेंसी हो डिलीवर होती है। तो इसलिए क्योंकि आप एक पार्ट ऑफ नॉर्मल नेचुरल प्रोसेस के तहत हैं, तो इसलिए आपको घबराना नहीं चाहिए। दूसरी बात यह है कि हर पेशेंट के साथ
Ma'am,
कॉम्प्लिकेशन नहीं होती। यस,
sorry to interrupt.
या
साथ साथ में can we also speak a little in English so that the people
Yeah,
who
yeah,
don't
definitely.
understand Hindi,
I
yeah.
thought I thought I was speaking in English, so maybe if there are some people who don't understand, I'll continue to speak in English. For me, it's
Yes,
absolutely
we
fine.
can do 50-50. Like,
Okay,
yeah.
okay, okay. So, what I want to tell you, dear ladies, that this is a wonderful time of your life. So, every day gain knowledge, but don't add fear. Whatever is happening to your body is part of a natural process. So, in the first trimester, in the first 3 months, if you have nausea, G. Michelana, if you want to vomit, you want to puke, don't worry. You just get it out, and you'll find that the immediate time after that is quite okay to take something. All you have to remember is something should stay in your tummy so that you get the energy and the calories. In the first 3 months, you really don't need to put on weight. Any lady may even lose weight, but that should not put you on a negative track. And I always tell my patients that, see, how will you come to know? The baby is too small, less than 2 or 3 centimeters, long. So the baby can't tell you that I'm there. But a nausea, a wave of nausea or a vomit tells you, yeah, everything is fine with me, mom. Just be relaxed. So these vomitings should not be taken into a negative cycle. Don't become desperate and थक गए हैं हम, परेशान हो गए. Yes, if somebody has too many vomitings, nothing is staying in the tummy, then you don't have to delay. You have to go right away to your doctor so they can check your electrolyte levels, your ketone bodies, and you can get replacement fluid and nourishment. So give that decision in your doctor's hands, and never feel that you cannot approach your doctor. Yes, you have to have a very clear channel with your doctor. Now, coming in the next 3 months, which is the fourth, fifth, and sixth month, that is a wonderful time because the baby starts growing and starts making its presence felt by movements. And this is the time the weight gain will be there. Blood pressures can be low. You don't have to be afraid. Low blood pressure is always a very good sign for a doctor because we want all the blood supply to the uterus and not to your brain and to other part. We want lesser supply there and maximum supply to the uterus. So a hypotension, like sometimes the patients will say hamara blood pressure bahut low hai and she very low bp, I feel very low. No, it's very nice. You should actually be thankful that you are not going to have problems of high blood pressure. Now, in the last trimester, the seventh, eighth, ninth month, these are the times that any rapid change, any problem can creep up. Like some women can develop diabetes or hypertension. So herein comes the time when your doctor, who has been, vigilant and who has done all the screenings, testing you time and again that you are not falling in the high risk, they can prevent these problems. And if anything develops despite clear screening and all that, then they are well within their time to take care of you. So mostly all women end up with a very nice outcome, that is there is a healthy baby and a healthy mother. So this is a journey in which there is no place for being unhappy. Let me tell you that women who have very difficult times also, we get, as Ansuya said, I get high risk pregnancy. So I get patients who have had mishaps, who've had multiple abortions or IUDs, babies have been dying in the uterus, and they're really desperate. But even to them, I tell them that put your worries on me and you just relax. You just enjoy your pregnancy. One time I'm going to take a detailed history so that I know what I'm dealing with. But after that, you don't have to keep looking back. See, when we are driving a car, we are looking at the rear view mirror. आगे का जो शीशा होता है जिससे हम पीछे देखते हैं, तो हम मुड़ मुड़ के नहीं देखते, उसी से देख लेते हैं. So we don't have to look back at the past history every now and then. You don't have to go back into that depression that what if this happens, what if that happens. Just believe in God, be grateful, choose a good person who can hold your hand, and then just have faith and trust and confidence. Many times, I take care of a patient, and then for some family reason, they have to go to another city for their delivery. So when I send them with a lot of positive counseling. I tell them, you are taking the brand of myself with you. Don't worry, whoever is your doctor, if you are confident, if you are happy, and things go smooth, it'll be a happy and healthy outcome. And believe me, majority of the patients, they always revert and they always convey, yes, ma'am, we had a normal delivery just because we were thinking what all you had taught us. So basically, if a doctor teaches you, fine. Otherwise, if you are educated, you can always, learn. And sometimes the doctor may be very busy, but if you are interactive, if you are ready with your questions, then you will get the right answers. So my tips to all the mothers to be is that there is no room to be unhappy if you are carrying a baby inside your tummy, because we as a mother have a very very big role to play in how we shape the baby's thought process, that baby which is growing in our body. I am a doctor, but in my last few minutes, I would like to share my personal experience that the first time I was a doctor, I was knowledgeable, I knew everything, but I was so apprehensive because as a mother, it was my first time. So I was so scared of normal labor. I thought, pata nahi normal delivery mein kya hota, I want a cesarean section. My baby was very considerate because she decided to stay a breech. So I was very happy that I'm going to have a cesarean. I had a cesarean. But then second time I thought, okay, I am a doctor and I'll never know what labor pains are. So I just second time I realized there's no point in being scared. I mean, we are doing something which nature is, leading us on. So second time I was so relaxed that my baby, my son, was cephalic, like in the normal position, and I had a normal delivery after cesarean. So I always tell my patients also that all you need in pregnancy is just be intelligent, be alert, be interactive, listen to your doctor carefully, but don't take back any scare. अगर तुम डर के निकलते हो अपने डॉक्टर के क्लिनिक से, then I think there's something wrong. I mean, you don't have to be afraid. If you're a pregnant lady, first thing is be fearless. God is with you because He is the one who has made life grow into your body. So you cannot afford to be. अगर भगवान में विश्वास करते हो तो डर की कोई जगह ही नहीं है. अपने डॉक्टर के कमरे से जब बाहर निकलो तो you should be more empowered, more knowledgeable, and more happy. So, my message to every pregnant lady is that whenever you have any questions, please write them down. And when you are sitting with your doctor, you should share all your troubles so that you get all your answers from the right source. Definitely, a educated, knowledgeable mother in law, or a mother, or a friend who are positive motivators are a very big help. And it's my advice always that the woman should be accompanied with her husband and or mother-in-law. If the mother-in-law wants to come, I welcome them because they three are a team. And with them, I am the person. So all four of us have to be on the same page so that whatever I tell, it is translated. And any doubts, if the father, if the husband, or the wife, yani the pregnant lady are having, this is the time that the doubts should be cleared. And I will be really happy to take any questions from the audience. And anything which comes to your mind, please feel free. I want to say thank you to this iMumz application. Anusuya, I want to put it on record that uh, I have never, kind of shared the link with my patients. But one time, one of the patients came back to me and said, "Ma'am, we heard your talk on iMumz and we were very impressed." So, Rewari is a very small city, and I never imagined that here the patients would be alert enough to, check into apps. So now I think I am also empowered to share this link with my patients because I believe that there are numerous talks by all very knowledgeable obstetricians of the country. I must congratulate this iMumz, Dr. Jaydeep, and all the whole team. So, Ansuya, if there are any questions, I'll be happy to
Oh,
take
they
them.
have a lot of questions for you. Okay. Now, the first question, Shruti says, I want to know that in case if we have normal fever, cough, cold, body ache, throat pain, etc., how to take care of ourselves in pregnancy?
Okay, so first thing I will say, if it walks like a duck, it quacks like a duck, it is a duck. So these are the times if somebody is presenting with viral fever. So I would say first and foremost, please don't ignore, don't neglect. First of all, get your COVID test because आजकल के दिनों में अगर वायरल कोराइजा कफ कोराइजा फीवर है तो हमें रूल आउट कर लेना है दैट इट शुड नॉट बी कोविड so that we can protect the others. Of course, all viral fevers are infectious, so you have to take that precaution so that your partner or your young child, other baby, doesn't get the viral infection, whatever it is. Now, coming to taking care, you have to understand that in viral fevers, it is going to be all right in its own course of time in 3 to 5 days. And you have to only bank on antipyretics, that is paracetamol, which is not harmful in any period of gestation. You have to maintain hydration, you have to rest, you have to take good diet. And then, if you are having cough or anything, the best remedy for your cough is steam inhalation. And yes, if the cough is purulent, अगर उसमें पीला कलर आने लगता है, which means there is added bacterial infection, then you need to see the ENT specialist who will check your throat, who will check your nose, who will find out that if there is any added bacterial infection, and antibiotics will be added. In the first 2 days, I don't think if it's just fever and cough, common cold, you should add any antibiotics. However, if there is too much of malaise, too much of symptoms, then one can go and see a clinician or a ENT specialist. But crocin is very safe, I would say that.
Thank you very much, ma'am. Now, the next question, Konika says, I'm having pain in the lower abdomen from the time I have conceived. As per the ultrasound on 3rd of August, it is 4.2 week. So,
Okay.
almost 10 days back, it was fourth week. So, is it normal to? I see a lot of questions here also about abdominal pain in pregnancy. So, it'd be
Yeah,
nice if
so
you
I want to tell all the pregnant ladies that one has to understand difference between pain which is actually because of normal pregnancy and pain which is because of some complication. So let me tell you, in early pregnancy, if there is severe pain in abdomen, then we do an ultrasound, an early ultrasound, only to rule out where is the pregnancy. Like in this case, what's the name of the patient, Ansuya?
Konika.
So, Konika, actually, 4 weeks is not a time when I would do an ultrasound, but I am sure because you were having too much of pain, so your doctor may have asked for an ultrasound just to make sure that your pregnancy is in the uterus and not in the tube. So, because if it's a tubal pregnancy, severe pain abdomen can be the only symptom, and if a doctor just postpones, then a very difficult diagnosis gets missed. So, I think if it is an intrauterine pregnancy, you just don't need to worry about it at all. Take the pain in its own stride, especially if it is in the uterus. You have to understand that uterus is an organ which is very muscular. It is not used to having anything inside. Throughout the time, from the time a girl is born till the time she gets pregnant, the uterus has been totally empty. And now it is only at the time of pregnancy that a foreign DNA, the baby comes and sits over there. So there are a lot of changes which are happening in the uterus. And the most important thing is that if the uterus stretches, the muscles start contracting and that causes pain. So most often, if the pregnancy sac is in the uterus, then the pain is not because of any abnormality. It is just because of the inherent nature of the uterus to contract. And this is the time you should just relax, enjoy. I generally try and explain my patient so that she takes minimum medicines. Yes, but sometimes the doctors do prescribe some little bit of progesterone hormone, which is the pregnancy hormone. And yes, that does give comfort to some of the patients. But I mean, I do more of counseling and less of medication. And Konika, if the pregnancy is in the uterus, please don't worry. Just continue to take your Folvite. And after 3 weeks, go for a review scan. By that time, the baby would have grown big and the fetal heart would have come. And then you can be reassured that everything is going fine. Till then, just be happy if you get a wave of nausea or a vomiting every day or every other day.
Thank you, ma'am. Since we are still discussing abdominal pain, I think you've already addressed this. Smriti says, I had an extreme pulling sensation at my abdomen just for few minutes, like 5 minutes. And this is the first time I'm feeling it at 23 weeks. Is this a normal thing? I think that's what you were mentioning, right? When it is
Yeah,
expanding.
it could be that she has held on to her, reflex to go and pass urine. Sometimes what happens is that overnight women, they don't pass urine, and आपकी रात में your bladder is full. When you go in the morning and go and do you when you micturate and you come back, then you have a tight sensation on your uterus. Basically, what happens is that when the urinary bladder contracts, the nerve supply of that S2, S3, 4 and the uterus is the same. And sometimes women start experiencing tightness in the uterus. So basically, you should do frequent emptying of the bladder. This is one of the reasons that one can have a very, sensitive uterus. And whenever you're passing urine after a long gap, you may even experience pain in the uterus. The other thing is if somebody's been standing for long. So this, if you're doing long hours, you're standing for a long time, that time also in 20 weeks or something, you can have this tightening and pain. And another thing could be Braxton Hicks. Again, Braxton Hicks is a normal phenomena where the uterus contracts and relaxes. It's actually inherent property of the uterus. But yes, if somebody is very sensitive and if they are very regular, you cannot ignore them. I won't say that just ignore them unless if they are very infrequent. दिन भर में एक ही बार हुआ, you can ignore. पर अगर 1 घंटे में 4 बार हुआ, then you should always inform your doctor. This, it could be that your uterus is trying to push out the baby earlier than it is supposed to. So I would say you'll have to see how severe is the pain. And I always tell my patient, if you're having pain, the first thing is go and lie down. Whatever you're doing, just forget about it. Go and lie down in the left lateral. बाई करवट से लेट जाओ, आराम करो. If in half an hour to 1 hour आपका पेन खत्म हो जाता है, it means it is not sinister, it's not dangerous. But आराम करने के बाद भी अगर आपको वो waves आती रहती हैं, then better to come to the hospital and show me, because I will be the best person to judge that is this pain going to cause any further trouble. Because after all, the labor pains are nothing but exaggeration of these similar contractions. So we cannot ignore them. But yes, if this is infrequent, once in a whole day, you can leave it. Another kind of pain which troubles a lot is called the ligament pain. You know, just about your hip, anteriorly, आगे की तरफ, lower abdomen में, जहाँ पर आपका इंग्वाइनल लिगामेंट होता है नीचे, वहाँ पर कई बार बहुत सिवियर पेन होता है, एंड दैट इज कॉल्ड लिगामेंटल पेन. तो वो भी एक्चुअली वो डेंजरस नहीं होता है, बट कभी कभी वो बहुत पेशेंट्स को ट्रबल करता है. सो आई थिंक इफ यू हैव एनी काइंड ऑफ प्रॉब्लम, once you tell your doctor and they see and rule out the dangerous reasons from the not so troublesome reasons, then you can take care of them at home.
Thank you so much, ma'am. Just I'm seeing a lot of connected questions, so I'm going to
Please.
take them up. Ruby says, you just mentioned if people hold the urine, they might feel abdominal pain. But she says she's using the washroom every 30 to 40 minutes, and whenever she goes, she feels a little bit of pain in the lower abdomen. And whole night she's not able to sleep properly because of this.
So I would like to ask her, what is her period of gestation? Is she
She's in the
in her eighth
19th
or
week.
ninth month or what?
19th week.
Okay, so if she's in the 19th week and she's having so much of frequency, I think she should go for a urine examination, because one of the reasons of pain abdomen is even UTI. If a woman is having infection in the urinary bladder, in the urine, again you're going to have frequency of micturition, which Shruti is having every 30-40 minutes. If she has to go to pass urine, definitely she may be having urine infection, and that will cause frequency as well as pain. So I think it's better that she should get her urine examined. If there is pus significant pustules, then culture should be done so that the appropriate antibiotics can be started right away.
Thank you so much, ma'am. Now, Manu says her TSH level is 3.1, FT4 is 1, FT3 is 3.2. She has no other problem. What should be the dosage of thyronorm medicine is what she
No,
wants to know.
actually, what is her period of gestation? And it is very, very
It is 13.3.
borderline. So
13.3.
I think her doctor would have prescribed something like only 25 micrograms, because it's very minimally raised, and it's not grossly hypothyroid, I would say. So we always start at a minimum dose. It can be anything between 12.5 to 25 microgram, and after a month the TSH levels can be repeated to see. I think that she doesn't need more than 25 microgram.
Thank you, ma'am. The next question, Kanika is 14 weeks pregnant. She says my PAP value is low. The screening test is 100% accurate. Doctor suggested me to go for amino test. I'm scared of this test. Please
No,
suggest.
I mean, like, it's not very easy to just tell. I would like to know what is the ultrasound scan saying, right? What is her age? What is the age of this patient? What does her NT-NB scan, like her nucleotranslucency and nasal bone, and then her dual marker? So they are all to be taken together, and
Okay.
then depending upon, see, if a woman is already 35 years age or 40 years, so her a priori risk, the risk for her to have chromosomally compromised baby is higher. But if she's 25 years or something, so her a priori risk is not much. But depending upon the levels of her dual marker and her NT-NB scan, so it's a composite risk stratification which will be computer generated. So actually, I can give my telephone number, and if the patient would like to, just WhatsApp me, then I can tell, because otherwise it's not easy to explain the interpretation. And what I can
Understood.
say is that whoever is the doctor, or the second step, if the risk of screening comes that the patient is in the high risk, what we are supposed to understand is that this is just a screening method. You understand? Can I take 2-3 minutes to explain screening? What is
Yes, yes,
screening? Can I?
definitely.
Okay. So, see, my dearest patients, now everybody wants to have the perfect child, including the doctor, wants to give the perfect baby to every pregnant lady. What we are afraid of are that the babies should not have structural abnormalities. When we say structural abnormalities, we mean कि बच्चे के सिर में, ब्रेन में कोई कमी ना हो, पीठ चौड़ा ना हो, स्टमक में कोई ट्यूमर ना हो. तो जो बड़ी बड़ी प्रॉब्लम्स होती हैं उनको 12-13 हफ्ते के अल्ट्रासाउंड में या 18 हफ्ते के अल्ट्रासाउंड में देख के फिर टर्मिनेशन कर देते हैं हम डिफेक्टिव बच्चों को. नाउ समटाइम्स व्हाट हैपेंस इज दैट द चिल्ड्रन आर स्ट्रक्चरली नॉर्मल बट क्रोमोसोमली एबनॉर्मल. यानी कि आप लोगों ने सुना होगा कि बड़ी उम्र की औरतों के बच्चे में मंद बुद्धि था, डाउन सिंड्रोम था. तो डाउन सिंड्रोम के बच्चे स्ट्रक्चरली ठीक दिखते हैं, पर उनकी क्रोमोसोम में गड़बड़ होती है. अब हम के कैसे पता चलेगा कि ये बच्चे को कुछ क्रोमोसोमल एबनॉर्मलिटी है? तो मैं एग्जाम्पल जो पेशेंट्स को समझाती हूँ वो ये है, अगर आपके शहर में ये कह दिया गया कि एक टेररिस्ट आ गया है और टेररिस्ट ने काले कपड़े पहने हैं, 6 फुट का है और रेलवे स्टेशन से भागेगा, तो क्या करेगी सारी पुलिस फोर्स रेलवे स्टेशन पे खड़ी होके जितने भी लोग रेलवे स्टेशन पे आएंगे उन सबको टेस्ट करेगी कि भाई 6 फुट से ऊपर जितने लंबे लोग हैं एक तरफ हो जाओ. जितने लोगों ने काले कपड़े पहने एक तरफ हो जाओ, और बाकी जो जो छोटे हैं, काले कपड़े नहीं पहने, 5 फुट 8 के है, 5 फुट 5 के, उनको सबको जाने देगी. सो स्क्रीनिंग ओनली मीन्स कि ऑल द सस्पेक्ट्स आर कीप kept aside, right? But every man who is 6 feet or somebody who's wearing black clothes is not a terrorist, right? So to find out the terrorist, then again they have to do more tests. Like भाई अगर उनके पास कोई फिंगरप्रिंट है, कुछ डीएनए टेस्ट है, तो उन 50 लोगों का वो टेस्ट किया जाएगा. उनमें से जो पकड़ा जाएगा वो कल्प्रेट है. सिमिलरली अगर हम पैपे, हम क्या कहते हैं बीटा एचसीजी, हम क्या कहते हैं एनटीएनबी, ये सब कराते हैं, तो हम स्क्रीन कर रहे हैं. जितने लोग सब सब स्क्रीनिंग से निकल जाते हैं तो दे आर मोस्टली totally fine. But the suspects, they can have screen positive. Now, screen positive doesn't mean that your baby has Down syndrome. It's just that we need to see, we need to do definitive test so that we know कि ये डाउन तो नहीं है. तो यदि कोई डॉक्टर अपने पेशेंट को स्क्रीन पॉजिटिव फाइंड आउट करता है, तो देर आर टू थिंग्स. वन थिंग इज आई ऑलवेज टेक अ सेकेंड ओपिनियन, एंड सेकेंड थिंग इज इफ द टू ओपिनियंस मैच, यस स्क्रीन पॉजिटिव है, तो फिर हम एमनियोसेंटेसिस, सीवीएस, कोई भी चीज जरूर करते हैं ताकि हम कॉन्फिडेंटली कह सकें नहीं हमने टेस्ट कर लिया है, ये स्क्रीन पॉजिटिव था बट ये एक्चुअली बच्चा एबनॉर्मल नहीं है. या अगर हमें पता चल जाता है कि भाई एमनियोसेंटेसिस पे कि इसका क्रोमोसोम एबनॉर्मल है, 21 ट्रायसमी है, 3 क्रोमोसोम्स ऑफ क्रोमोसोम 21, तो इट मीन्स इट्स डाउन सिंड्रोम. सो देन वी कैन टेल द कपल कॉन्फिडेंटली कि नहीं आपके बच्चे को डाउन सिंड्रोम है. तो एक्चुअली गलती ये होती है कि बिना समझ के, बिना समझाए जब पेशेंट को स्क्रीनिंग टेस्ट के लिए भेज दिया जाता है, तो रिपोर्ट जब आती है तो मरीज समझ नहीं पाता कि ये मेरे साथ क्या हो गया. और एक इंसानी दिमाग है कि हमेशा आप अपने साथ कभी भी बुरा नहीं होना चाहते, तो इसलिए हमेशा कभी भी कोई डॉक्टर आपको कोई टेस्ट बताए तो यू आर इन योर राइट टू अंडरस्टैंड ये टेस्ट क्या है, इसकी इंटरप्रिटेशंस क्या होंगी, ताकि जब रिजल्ट आए आप यानी घबराए ना. सो यू कैन जॉली वेल गिव माई नंबर टू द पेशेंट. So if she has any hassle, I can always sort it out personally one on one. But that was my message to all the patients that please get your screenings done. But screen positive does not mean that you are going to have this problem or the baby is having that problem. We definitely have to do the diagnostic tests. And amniocensus is a diagnostic test. And one need not be afraid to know the truth, because truth will bring you real happiness. And fear, apprehension, kabhi ye to nahi hai, ye to nahi hai, that can carry on, so that's no fun.
Thank you so much, ma'am. The next question, Harshita says, I've completed my 30 weeks. I had about she had bleeding and her placenta was anterior 1.2 centimeters away from internal loss. Are there any chances of migration? I am taking complete bed rest. Please tell me what other precautions should I take?
So the first thing is that the placenta is 1.2 centimeter above the internal wall. So believe me, Ankita, you don't have to be really afraid. All you have to do is stay vigilant, but don't be fearful. डरने की कोई ज़रूरत नहीं है. बेड रेस्ट अगर आप कर रहे हो तो आप एक एक्स्ट्रा प्रिकॉशन कर रहे हो. वैसे बेड रेस्ट की इतनी ज़रूरत नहीं होती. The uterus will keep growing, placenta will keep migrating, and finally, I am quite sure everything will be okay with you. All that you have to avoid is intercourse, because we don't want any direct impact on the uterus or in the lower segment or in the cervix. Although, let me tell you that if anybody has placenta previa, that means placenta is in the lower segment, then with all the precautions, bed rest, this and that, the bleeding can be painless, causeless, and recurrent. It'll happen again and again. It'll happen without any pains, and there is no reason. The only reason is that as the uterus is growing big, the placenta is inside. When the uterus grows big and the placenta doesn't go at the same speed, then there is shearing. There is some separation between the placenta and the uterine wall, and so little bit of bleeding comes. सो दैट इज वाई बार बार आ सकती है, बिना किसी प्रोवोकेशन के आ सकती है, और recurrent, causeless and painless, दर्द भी नहीं होता है. It's just because of the growing of the uterine size. So I think in your case, don't be afraid, but just avoid intercourse, just avoid heavy work. And if you're a working woman, just choose where, how much you have to travel or you don't have to travel. If you have the luxury of resting, there's no harm in resting. But believe me, with complete bed rest also, if the placenta will separate a little bit, there will be a little bit of bleeding despite your bed rest also.
Thank you very much, ma'am. Now, the next question. I know you covered a lot about how to be positive and prepare for labor, but it is such a hyped thing in our society. Labor pain, labor pain, labor pain. It is like your second birth, and it is like really hyped. So Poonam is saying, what should I do for a normal and healthy delivery and for a healthy pregnancy? I'm somewhat scared by hearing about delivery from everyone. So I am sure this will resonate with many other women. So I thought I should take this up.
So, Poonam, I must congratulate you that you are pregnant. And I must tell you that if every woman can do it, so can you. Just have the confidence that it is not going to be tough. It is tough because we are afraid. Only thing is, I always tell my patients that it is here. The confidence and the courage is in your mind, it's not in your body. If, see, there are women who will not have, they will have very mild pain and they'll be shouting at the top of their voice. सो यू नो, अगर आपने अपनी ये जो आप आई मम्स के ऐप देखते हो, इसमें डॉक्टर्स का सुनते हो, तो आपको समझना चाहिए कि डरने की बात ही नहीं है. लेट मी टेल यू दैट नेचर, you know, God's ways are the best ways. Human beings cannot match it even. And but you can only experience the natural way if you learn to catch small signals. See, the thing is this: fear is the worst force. It actually takes away all the joy of pregnancy, all the joy of delivery. I can tell you one thing: if a woman starts enjoying the vomitings, starts relaxing in the pain abdomens and not getting worried, and is very vigilant and happy with the movements of the baby, you know, सेकेंड टाइम में क्या होता है, बोन्स लूज होते हैं, हिलने डुलने तक में दर्द होता है. एंड इफ यू कैन टेक दोज पेन्स in a very positive way, and lastly, if you're very grateful and very prepared for your labor, that I'm going to bear the pain, I'm going to enjoy my labor pain because it's going to bring me closer to my baby, I'm telling you, these positive thoughts, they work wonders. I always, my patients will ask me, Doctor, how many days are left? So I say, no. I also don't know what is the date of your delivery, what will be the time of your delivery. All I can say is you are every day you are moving closer to your date. So you have to understand that you are, it's a countdown. 10 दिन थे, अब 9 दिन रह गए, अब 8 दिन रह गए. तो enjoy करो, क्योंकि you have to be prepared for the next phase. Let me tell you, it is very enjoyable to have a child, but it is very physically and emotionally taxing also. तो लास्ट के दिनों में घबराओ मत, enjoy करो. And you have to understand what labor is. Can I take few minutes, Ansuya, to explain labor?
Definitely, definitely, please.
Okay. Okay, so dear patients, for labor, all you have to be prepared is that the pains are never strong from word go. You know, God has made it in such a way that the preparation for the delivery starts in the ninth month itself. You understand that the uterus starts to prepare to push out the baby. Once the baby is totally mature, the baby shuts off the engine. The engine, which is, you know, keeping the uterus quiet, it just shuts it off. And now the uterus starts, you know, acting. So, uterus starts developing receptors where the oxytocin is going to act. So, it's a very synchronized process in the nature. provided we don't cranialize it, we don't try to put too many questions. Fear actually stimulates the negative hormones, and negative hormones will make sure that we move away from normal start of normal labor. तो एंशियस होते हो तो लेबर पेन स्टार्ट नहीं होते, रिलैक्स होते हो लेबर पेन स्टार्ट हो जाते हैं. लेबर पेन में होता क्या है, जैसे द वे यू हैव पेन इन मेंसेस, it starts from the back, it comes in front, and it is intermittent. That means it is not there all the time. It comes for few seconds and goes away. Initially, in the first stage of labor, the pains may be very infrequent. They may come after 15 minutes, 20 minutes, half an hour. But then, God's ways are such that the pains will slowly keep increasing in duration. They will not be for 10 seconds, they will be for 30 seconds. They'll not come after half an hour or 20 minutes, they'll start coming after 5 minutes, 10 minutes. And I'm telling you, if you do not kind of hinder it with your negative thought, the process of labor is very synchronized. You can actually time your labor pains, contractions with your watch. So once you learn that when there will be labor pain, the uterus will become tight and there will be a wave of pain, but it will go away. Believe me, the strongest pains of second stage, that is the time जो फिल्मों में नहीं दिखाते, जोर लगाते हैं, ऊ ऊ चिल्लाते हैं, that lasts for hardly less than a minute. That strong contraction when you have to push out the baby also does not last for 1 minute. So basically, the uterine contractions last only for something as long as 30, 40, or 50 seconds. And imagine if a intelligent lady has strategized for 50 seconds, that 50 seconds, how am I going to spend my time? Am I going to shout in those 50 seconds at the top of my breath that I can't hear anybody trying to tell me how to take the pain? Or in those 50 seconds, I will just recite Gayatri Mantra in my mind. Gayatri Mantra means कि ईश्वर हमें बुद्धि को प्रज्वलित करो. So it is wisdom you want. So you have to divert your attention from the labor pain to something for only as long as 40 to 50 seconds. And after that, it passes away. And for the next 5 or 7 minutes, you're absolutely pain free. So in the first stage of labor, if anybody, आप उस 40-50 सेकेंड के दर्द में चिल्ला चिल्ला सकते हो, या फिर आप कोई मंत्र का जाप कर सकते हो, या किसी मंत्र को सुन सकते हो, कोई गाना सुन सकते हो. Somebody whom you trust, you love, you want them to be with you, take the permission, let that person be with you in your labor pains. Nothing to be afraid. And that is the only thing that you enjoy. You prepare yourself. I am going to have a normal labor and I'm going to trust my doctor. See, if the doctor finds that the baby's heart is showing a lot of variations and some wrong thing can happen to the baby, then obviously we cannot take it that far that we cannot put the baby's life in danger. But believe me, a mother's life is never in danger. She is distressed because she is not mentally prepared. So prepare yourself, be happy, and just think, if XYZ could take the pain, why can't I take the pain? I have told you my own experience that I was afraid. So first time I wanted a cesarean, I got a cesarean. Second time I was brave. I just thought, "Arey, this is my only time I will have a delivery. Let me try normal." And I had a normal vaginal delivery. So, and it's not that we don't get pains. Yes, the pains are there. But there are so many strategies to pass those 30, 40 seconds. Just plan that. Plan that with your husband, plan it in your mind, plan it with your attendant who will be with you in labor. जस्ट वो बहुत अच्छे 8-10 घंटे होते हैं, उन उस जर्नी को भी इंजॉय करना है, हैप्पी होना है, गाने सुनने हैं, कुछ भी इंटरेस्टिंग करना है और निकल जाता है. जो सेकंड स्टेज होती है जिसमें एक्चुअली बियर डाउन करना होता है, वो बहुत बेरेबल पेन्स होते हैं, बिकॉज उसमें आपको भी पता है, डॉक्टर को भी पता है कि नाउ द बेबी इज गोइंग टू एक्चुअली कम आउट. सो हैप्पी हैप्पी लेबर फॉर यू.
Amy, I'll call you. Hello.
या
So, I'm moving on to the next question. I think you were asking about Kanika's status, amniocentesis. Wala. So she has said ultrasound is normal, 1.1 in NT scan, and age is 31.
Okay, no, but like now, what is the dual marker? What does the report say? No? What is the things? What is the report exactly saying? What is the risk reported on the paper? Because I cannot offhand tell you what are the correct moms. So you have to let me see the report and I can tell her that. Only thing is that if it is coming screen positive, it is written that she is screen positive for Down syndrome or trisomy 21, then without being scared, she should subject herself to CVS or amniocentesis. And if the risk is only for Downs, then NIPT can be done. But basically, NIPT itself is also only a screening test. So I prefer not to get an NIPT in a person who's screen positive. I would go for a invasive test, either CVS or amnio, and get a microsomal array.
Thank you so much, ma'am. Okay, so the next question, I see a lot of people complaining about backache, and I also see a lot of people complaining about breathlessness. So, are these common variations of pregnancy, and like when is the alarm sign to worry
Yeah.
about?
So let me take backache first and then I'll take breathlessness. See, backache is very common in pregnant ladies and it can be because of poor posture. More often than that, more often it is because of bad posture that a woman has backache. We have to understand that the spine, actually, if there is a lot of lordosis, that means there is a the curve of the spine is enhanced, and it will be because of the growing tummy in front. There is a big belly in front, and the spine, the curvature is more accentuated, so that the center of gravity of the woman stays in the center, like in the big abdomen because of the pregnant uterus. So this yeah. So the curve of the spine increases. That is one of the reasons for having backache. So idea is just to take maintain, always be straight when you're standing. Like right now, I was also slouching. So when I'm answering, I kept my back straight. So if one remembers to keep the back straight all the time and tummy pulled in, then the backache will be less. And if you are having too much of backache, you have to understand that some pain relievers, some these gels, they may be helpful, but most often what helps is good posture, keeping the back straight. And actually, there are some exercises where the patients who stand with the wall and come down and straight up, keep the back straight, stomach pulled in, and that is one of the ways the backache will be less. But yes, if there is pain, you have to take a painkiller. Now, coming to the second part of breathlessness, see, breathlessness is a very, very important symptom. सांस चढ़ गया है, ठीक है ना? So because of pregnancy, early change of pregnancy, जैसे ही lady pregnant होती है, there's a lot of change in the amount of plasma. The blood volume increases, the plasma volume increases, and suddenly the woman does get this shortness of breath कि सांस पूरी नहीं आती है. But this is normal, but this could be also a reason that there is some problem in the heart, some problem in the chest, that the woman is feeling breathless. So if anybody feels breathless, one has to tell the doctor, and the doctor must always examine the heart and the lungs of the lady before saying that no, it's because of pregnancy and it's a normal change. I would say that every doctor must put the stethoscope on the heart of the patient and also must auscultate the lungs, so that if the heart is fine and the lungs are fine, there is nothing like asthma or a bronchitis or something, then we can reassure that this breathlessness is just a normal change of pregnancy.
Thank you so much, ma'am. We are almost running out of time. I'll take one or two questions. Since you mentioned VBAC and you were so passionate about it and you've done it yourself, Vaishnavi is 37 weeks right now, and she has a very supportive care provider. But can you share personal tips considering your experience? It will be very encouraging, is what she's saying.
See, I will say to Vaishnavi that if your pregnancy has gone up till 37 weeks with no problems, believe me, you will go into normal labor yourself. All you have to do is not keep waiting कि कब होगा कब होगा. Just enjoy the last 3 weeks and till 40 weeks. Don't worry कि किस दिन है. सो डू एवरीथिंग. जो भी सेटिंग करनी है घर में कर लो. कपड़े सेट करने, जस्ट गेट इन टू द मूड कि ओके आई एम गोइंग टू एंजॉय दिस. Choose the songs you want to hear, choose the mantra you want to hear, and have a plan in mind. Because let me tell you, the onset of labor can be just with contractions, or it could be with a discharge, which is blood mix, which we call as show, or it could be just the rupture of bag of membranes where the water of the baby comes out. So you can start your labor any which one way. But normally, if pregnancy goes on, okay, the blood pressure is fine, nothing wrong with the sugar levels, nothing wrong with the liver enzymes, everything is uneventful, then just relax. In your last few days, one जैसे स्विमिंग करते हैं ना, बहुत हाथ पांव मार रहे होते हैं, बट when you are floating, that's the time you can really enjoy. waves आ रही हैं, आप उन्हें float करें. तो अब last 3 weeks में एंग्जाइटी नहीं करनी है. बड़े प्यार से अपना बैग बनाना है, बच्चे का करना है, अपना सोचना है. You can do some meditation, you can do some listening to some nice chanting. Just have a plan कि when I will get contractions. Another thing is that what will be the time for admission. So I think majority of times what happens is that the women get very anxious. So because of their anxiety, that gets transmitted to the doctor also. So if you are in the same city, मैंने बहुत शुरू में बोला था that every patient should try and choose a good doctor of their neighborhood. Why I said neighborhood is sometimes we hear of a very competent doctor, but she's in the other city. So there are a lot of, you see, delivery is the most natural thing to do. आप अब हमारे रेवाड़ी में रह के आप दूसरे शहर की डिलीवरी, दूसरे शहर के डॉक्टर से जाके डिलीवरी कराना चाहते हो, तो सबसे पहले सोचो कि उस डॉक्टर पे स्ट्रेन होगा, क्या वो उतना टाइम दे सकेंगे, क्या आप कर सकोगे. सो इट विल बी ऑलवेज गुड टू हैव अ वेरी रिलायबल, knowledgeable, good setup in your own neighborhood, and somebody you can go. And believe me, the results of normal labor are best when our patients are local. You see, they come in the morning, they have little pains. We examine, they say, "Nee, nee, theek hai, heartbeat is fine, go." When the pains increase, then you come. So when you are in your house, you are, in a very free atmosphere. You're listening to music, you're seeing the movie. So the pains increase, you don't even feel the problem. So best is to get admitted when you are in advanced stage of labor. But yes, this is not for any patient who has got high blood pressure, who has got Rh negative, who has got enzymes which are deranged, or who has sugar problems. So if you don't have anything, then you can take the liberty. And especially if your doctor says that I want this, then you do it. But of course, I would say with all your strategies, what is your doctor's strategy, you should fall in line with that. But just you mentally be strong कि अगर डॉक्टर मित्रा ने समझाया है कि पेन्स बहुत बियरेबल है तो हैं, वैष्णवी के लिए भी होंगे, बाकी कनिका के लिए, सबके लिए होंगे, whoever is there. So only thing is that, and another thing is that these are some things which nobody else will be able to do it. Your husband may love you as much as they want. Your mother may be very, very caring and doting. She has had to take care of her labor pains. Your mother-in-law has had her share of pains. This is your share. Enjoy your portion. And that is the only way you'll be able to go through labor without any fear and enjoy the pain. I'm telling you my last thing I want to share, that when it was ninth month, the baby used to kick and I used to feel a lot of pain. And suddenly I realized one day, my God, this is the only time, and I'm not going to, get pregnant again. So let me remember how these kicks are. So the minute I started thinking that way, those kicks in the abdomen and those pains became very bearable and enjoyable. Similarly for labor pains, when I was having labor pains, I thought, okay, this is my time. Okay, the pain has come. Okay, I hope God you're opening up the cervix. So I was very positive during my labor pains. Otherwise, a doctor who has had a cesarean can never have a normal delivery. We are the scariest lot. But with my personal experience, I can say that if during contraction you are thinking positively, that yes, let the next pain be stronger and better, God, so that it opens the cervix more, so that my baby comes out faster. It works. It works like magic.
Thank you so much, ma'am. I'll just take 1 or 2 minutes. So, abdominal pain, I think we had addressed earlier. And somebody got a sudden pain yesterday, and then she asked her doctor what to do. And then she was given a tablet, Duvadilla.
Duodenal. Yeah.
Yes, twice a day. But now she's not feeling the pain. Now she's asking, can she stop the medication
If
then?
she's not having any pain, she shouldn't take.
Mm-hmm.
There's no need to
Agree.
take, there's no need to continue any medication. This is symptomatic. She had a symptom and the doctor gave a symptomatic relief. So if you're relieved, then rest and don't take. I wouldn't ever advise a patient to be on a long-term Duvadelan. It's a uterine relaxant. And these are the medicines which have to be taken under supervision. You can't take because your cousin took it. Your friend took a Dovatalon tablet, so you just decided to take mere pain hai, to main bhi le leti hu. No. I never allow my patients to take any medicines on their own. And whatever I think is right, appropriate, and for how long, I have to tell my patient. So it will be better. You should tell your doctor, you're symptom free. Can you stop? And I'm sure she'll say, okay, stop.
Mhm. Thank you, ma'am. Last question for the day. A lot of them are asking about COVID. Can I take the vaccine? When can I take the vaccine? Which vaccine? So, would you like to touch a little on it and then we'll close the
Yeah,
session?
yeah, that is very important for all the pregnant women to see is learn that pregnant women are more susceptible to the complications of COVID, as we saw in the second wave. So, my sincerest advice to all the pregnant ladies, to all the lactating mothers, is please do not be afraid of taking the vaccine. Any kind of protection is much better than no protection. So I would say in the first trimester, no, I don't want any lady to take a shot, even if it is of tetanus or if it is of vaccine for COVID. But once you are over with the first trimester, please take the COVID vaccine. And as per schedule, the next injection will be due after 3 months. So you must take that because all the women who have taken the vaccine, they are at lesser risk to develop COVID, or even if they develop COVID, they have milder symptoms. So don't be afraid. Between COVID, Covishield, Covaxin, and Sputnik, and all those, I would say whatever vaccine is available close to your place and where it is being given with all the protocols. That means the center which is maintaining the cold chain, like the government setups are doing it wonderfully well. They are managing it very nicely. Only thing is that there are too many numbers. So you have to see that. Otherwise, whichever center is maintaining, and actually they are very strict. You have to maintain the cold chain, you have to maintain all the protocols, and you have to get yourself registered, take the shot, and sit there in the center for half an hour so that there are no adverse reactions, and then go home and relax, enjoy, hydrate yourself. If you have fever, take crocin. If you have more severe symptoms, please inform the doctor. But I mean, I'm happy to share that in my own hospital, we are COVID approved center by the government, and we've already immunized something like 4,500 patients and a lot of pregnant ladies also. So it's not risky at all.
Thank you so much, ma'am, for talking to them with so much energy. They can't stop praising you in the chat. So, Thank you so much for this session. But a lot of them had a lot of questions to ask you. We are really sorry, due to lack of time, we could not take up your questions. But ma'am has tried to instill as much positivity and courage and support she could through this session. So we hope this session has given you more hopes towards having a healthier delivery, healthier pregnancy. And to all the questions that were not answered in the session, you can please post it in the. You have an option to copy and paste it. So just double click on the chat where you have written. Please post it in the feed section. And to all the people who are actually joined late and watching it now. I'm sharing the session link here. I have already shared it, but I'll share it again so that all of you can go back and watch this session on YouTube. So I think that should be helpful in case you have joined late. Uh, yeah, 1 second. Yes.
My only message is that a mother to be is the most privileged human being on the planet. When it's your pregnancy time, please don't, गमाओ it, don't lose it. ये इतने बेहतरीन क्षण हैं पूरे 9 महीने कि इस जर्नी को इसका हर दिन मेमोरेबल है provided you are grateful, provided you are fearless. There's no need to be afraid. Be empowered, be knowledgeable, but don't be fearful. Knowledge should dispel all the myths. जितनी भी मिथ्या है, जितने भी डूज एंड डोंट्स हैं गलत वाले, उनको मत आने दो. And enjoy a healthy pregnancy, a very, very satisfying labor. And then we did not touch upon lactation, but that is also very important. कि please अपने बच्चे के लिए मत डरो. There's plenty of milk for the baby by the pregnant mother. So don't let anybody discourage you. And if you are in a positive state, you will be able to feed your child very well. So happy being a mother and a safe birth and safe motherhood to all. And
So
Ansuya, if
now I
anybody
think
wants
I
my
have a
number,
topic for your next session.
sorry.
I'm saying, and then I have a topic for your next session. We can do it on lactation.
Oh, sure, no problem.
Yes, ma'am.
After
Please
the
go ahead.
gap.
What were you saying? Yes, after some time.
Yeah, but if you want, you can share my number and you can tell them to WhatsApp me directly.
Okay. Yes. In case they want
Okay.
to take appointments
Yeah.
with you, yeah,
But my
I'll.
choice is, my suggestion is every patient should make a very good survey of the available doctors. And once you choose your doctor, please learn to trust the doctor. That's the time the best comes out.
Done, ma'am. I'm just putting
Fine.
your number in the chat box. I think they can connect with you if they have any
If anything.
emergency
Yeah.
or if they want a second opinion or something like
Yeah,
that.
for sure. No problem.
Yes. Yes.
They have to only
Okay.
write care of iMumz.
Definitely, definitely. Thank you so much, ma'am. Thank you, all the users. We hope you have a great weekend, and we'll have ma'am back with many more sessions in future so that you get to see more of her positivity. Thank you, and have a great evening, everyone.
Thank you. Thank you, Ansuya.